After a series of high-profile child fatalities prompting state review and costly lawsuits, the Division for Children, Youth and Families is now under new leadership and reform efforts are underway. But some are concerned about the direction of that reform now that the House Finance Committee is taking a closer look at the price tag. This morning, the director of the Office of Child Advocate joins us, Moira O'Neill. Thanks for being here, Moira.
Morning, Adam. Thanks for having me.
So let's rewind a little bit. You were just getting started in this job a few months ago when there was a tragic incident in Derry involving a child fatality. A man killed his son and then killed himself. And you stepped forward and said that the state might have been able to prevent this. Explain.
That's right. So part of my responsibility is to oversee any child deaths. And so I was immediately informed that there was a death and had a preliminary look at the case. And it looked as though, it's sort of complicated in figuring out whether or not there's harm. And that's what the Department of, or the Division of Children, Youth and Families has to determine that in order to open up a case. So what they found was that the family was okay and the children weren't harmed. But the father was consistently asking for assistance. And they weren't able to provide any assistance because there aren't any mechanisms for providing assistance unless the family is under court supervision with the state. So it just appeared to me that had we been able to offer something, we might have intervened before such a tragedy happened. And it happened at the same time that there were bills moving through the legislature that would reinstitute what's called voluntary services. And those are services where you can help families who are at risk, but not quite abusing or neglecting their children.
Explain, what do these voluntary services do? How do you interact with a family to steer them away from the abuse and hopefully from that end result of a potential child fatality?
Right. So when someone suspects abuse or neglect and they report to the division, the agency will look at whether or not someone is abusing or neglecting their child. And that gets the courts involved. Sometimes children are removed. But so it's called voluntary services because the courts are not involved. There's not that abuse or neglect, but there appears to be some risk. The family is under stress for some reason. So this would allow caseworkers to say, hey, it looks like you need some help with whatever. It might be mental health services or parent coaching or some kinds of education around child development or access to services for the child. And so if they're able to implement those and work and build a relationship with the family, then the family gets strengthened and isn't likely to abuse or neglect their children.
And the House just defeated the bill that would have had voluntary services expanded, although that's being lumped in now to a couple of other bills. I know there's some work going on around all of this about how it's going to look, and it's still in process. But you're very concerned about right now with the trend, the direction this is moving in the House Finance Committee. They're very interested in making sure they can try to get as much reform as they can for as little cost as they can. Why is that problematic?
Sure. I mean, no one wants to spend money. I understand the challenge that's before them. There was a constellation of 3 bills that had services for DCYF, that had funding, it had positions, and it had the voluntary services. So what the House Finance Committee did was they consolidated down to one bill, Senate Bill 592, through their amendment, that has all of the DCYF related things. So that includes the voluntary services that I'm interested in. It did include incentive services, which would have been community-based things, programs that happen before anybody even thinks children are at risk. And it had many positions for the division. Remember that there was an independent study that was done 2 years ago on DCYF, and they made 20 recommendations out of that. This was following off of the deaths of the kids and part of the whole overall reform. So one of them was that they're really short-staffed and they're not able to manage. The other was that they didn't have voluntary services. Those are the 2 that are most critical to me. Also that they didn't have emergency response services in off hours. So that's been rectified. So in the bill, Senate Bill 592, they now have a few more positions available, and they do have $1.5 million for voluntary services. They've pretty much taken out what was $1.5 million for incentive services, and these existed about 10 years ago, where counties and municipalities received funding and they could do home visiting programs, helping people educate them about child raising and stuff to prevent people from being at risk. So much of the incentive funds have been taken out. The voluntary services are still there. So now it's just a matter of getting that bill out of committee. They're going to meet again next week. But it has been an arduous conversation with the DCYF administration about what to cover.
And And you found it frustrating at times that it seems as though we've had this conversation for a few years now, and you're joining it now as an advocate for the children, but it's clear that even though we've seen some pretty horrific child fatalities, that's not necessarily moving the needle for some legislators.
No, it really isn't, and I understand there are concerns about spending, but essentially you have to look at what the system is. Right now we only respond when children are harmed. The only thing that we can do is help children who are already harmed. But there are a number of children who are living in a chronic level of stress where their families are under stress. It might be poverty, it might be mental health, it might be drug abuse, and we're not able to help them because they're not fully abusing or neglecting their children. We have no mechanism for that. And if you ask me, it's going to cost more money down the road to have to remove children from their homes, get involved with court systems, find places. We have a shortage of foster parents right now. I mean, it's really sort of cumbersome. So, you know, you wish that the legislators could step back and think, if we invest now on fairly simple interventions, then we'll prevent the harm to the children, but we'll also save money down the line. And I have, and the Division of Children, Youth, and Families have provided a great deal of research to the members of the Finance Committee so that they can understand that there's actually cost savings in preventing abuse and neglect.
And you said it's going to be hard for you to hold DCYF accountable for doing its job if they don't have the resources to do it.
That's right. I think when people think about my office, they think of it as a complaint mechanism. People aren't happy with the DCYF service, they contact me. But quite frankly, if there's no caseworkers to respond to cases, then who can I hold accountable other than the legislature? So it's sort of a twist in turn of events here, and we didn't really expect that it would be the legislature that would be first and foremost on my radar to worry about. And until they give the DCYF what they need, then we're not going to be able to really expect the full standard of care from the agency.
Manchester Police Chief Nick Willard deserves a lot of credit for kind of sparking this conversation in some way when he came forward in 2015 after one of these child fatalities and said DCYF failed in this case. That really sort of got the ball rolling on this. When they were looking at who to hire for your position, he said, I really hope they can find someone who knows how to rattle the cages but also work collaboratively. How do you see your job moving forward in terms of being able to do those two things? It's a difficult tightrope act there to be able to hold people to account while still working with them. Yeah,
it is. It happens that I've done this work before in Connecticut, and I'm actually a scholar of these offices. I did a doctoral dissertation about this, so I've had the opportunity to speak with people all across the country who do this work. And I definitely found that taking that sort of aggressive approach where you're attacking all the time isn't necessarily productive. It really does require, it requires a deep scrutiny, but it also requires an ability to sort of collaborate and support people so that they can set up a system that works. Eventually, people just get tired of hearing about scandal all the time. There's a level of fatigue associated with that, certainly with the deaths of children. But while we have people's attention, we've got a great opportunity now to really work hard to convince the legislature, educate people about what works. There's a great deal of science on child development, and try to get those kinds of programs implemented so that we can move forward.
Are you optimistic that the state can solve this problem?
I'm fairly optimistic. I don't think that there's anywhere near enough what we need in this bill. I think that when you look at the data from DCYF, they need about 81 positions just to catch up to where they are. They're getting about 33. That's a start. We're in the middle of a budget, and so it's pretty remarkable that anybody's even thinking about contributing money here. The voluntary services are a start. There are still some home visiting programs that may or may not be able to help many families, but they're still there. So the message is out there that we have to get some work done. I think I would say that what's really important is that we were not finished. I hope this bill passes, but this isn't the end of it. We have to start in another month or two on the next budget, and we have to make sure that there's lots of resources for this agency going forward.
All right, Maura O'Neill, the child advocate.
Thank you so much
for your time.